CNA Practice Test 70 Questions, 2026. Question 1. A CNA is recording the 24-hour urine output of a patient with kidney issues. What 24-hour urine value would warrant a report to the nurse? A. 800 cubic centimeters. B. 1,400 cubic centimeters. C. 1,900 cubic centimeters. D. 600 cubic centimeters. The correct answer is 600 cubic centimeters. Normal urine output is typically 800 to 2,000 cubic centimeters per day. 600 cubic centimeters is low, oliguria, and could indicate kidney failure or dehydration. Question 2. A resident drinks 8 ounces of milk during lunch, but the standard measurement of documentation in the facility is cubic centimeters, cc. What value would the NNAAP record? A. 240 cubic centimeters. B. 360 cubic centimeters. C. 120 cubic centimeters. D. 8 cubic centimeters. The correct answer is 240 cubic centimeters. 1 ounce is equal to 30 cubic centimeters, ml. Therefore, 8 ounces x 30 equals 240 cubic centimeters. Question 3. The NNAAP prepares to give a bed bath. Before turning the patient to rub their back, the NNAAP notices that he has a Foley catheter in place. Where should the NNAAP secure the catheter to ensure it's not pulled during the bath? A. To the lateral aspect of the patient's thigh. B. To the bed sheet. C. To the medial aspect of the patient's thigh. D. To the bed. The correct answer is to the lateral aspect of the patient's thigh. Securing the catheter to the lateral thigh prevents traction on the urethra during movement. Question 4. A patient just received news about the death of his spouse. He states to the NNAAP, "I can't believe this has happened to me. I don't know what to do. How can I live without my wife?" The NNAAP responds with, "Aide, you will need more time to cope with this loss." B. I understand you're in pain. I'll stay with you. C. This kind of thing will happen to everyone eventually. D. Do you and your wife have any children together? The correct answer is I understand you're in pain. I'll stay with you. This response uses therapeutic communication by validating feelings and offering presence. Question 5. Your patient has a low pulse, seems slightly confused, and has a sweet, fruity-smelling breath. You suspect A. Hypertension. B. Hypoglycemia. C. Hypotension. D. Hyperglycemia. The correct answer is hyperglycemia. Fruity breath is a classic sign of ketoacidosis, a complication of hyperglycemia, high blood sugar. Question 6. Which of these would be inappropriate when caring for a diabetic patient? A. Keeping the patient's feet clean and dry. B. Carefully monitoring and reporting the patient's food consumption. C. Ensuring the patient has plenty to eat throughout the day. D. Offering the patient a thermal foot soak once a day to relax. The correct answer is offering the patient a thermal foot soak once a day to relax. Diabetics often have neuropathy, loss of sensation. Thermal soaks pose a high risk of burns. Question 7. A fractured hip is A. The most difficult injury from which to recover. B. The most frequent injury when a resident falls. C. The most expensive injury for rehabilitation. D. The injury that generates the most complaints from residents. The correct answer is the most frequent injury when a resident falls. Hip fractures are a very common and serious consequence of falls in the elderly. Question 8. As a CNA, you become an advocate for the resident that you care for. This means you A. help them make difficult decisions regarding their care. B. Ask questions regarding their care. C. Complain when something that they don't like is done. D. Communicate their needs when they might not be able to. The correct answer is communicate their needs when they might not be able to. Advocacy involves speaking up for the patient's wants and needs. Question 9. You should be careful when changing ______, as this is a common site for unintentionally discarded needles. A. A resident's bed linens. B. A clothing. C. Bath towels and washcloths. D. A trash bag. The correct answer is a resident's bed linens. Needles are sometimes accidentally left in bed linens, posing a stick hazard to staff. Question 10. When having a conversation with a dysphagic patient, it's important not to A. Finish what you believe they are trying to say for them, B. Encourage them to use all of their senses to convey their needs, C. Praise their efforts, D. Use visual aids and other devices such as a whiteboard. The correct answer is finish what you believe they are trying to say for them. Finishing sentences can be frustrating and demeaning. Patience is required. Question 11. Which of these is not true about condom catheters? A. They are a treatment used to avoid urinary tract infections. B. They are internal catheters and not as effective as external catheters. C. They are more effectively used if pubic hair is removed around the area. D. They should be changed frequently. The correct answer is they are internal catheters and not as effective as external catheters. Condom catheters are external, not internal. Question 12. After assisting a resident onto a bedpan, it will help to make the patient more comfortable if you A. Turn on the TV for distraction, B. Raise the head of the bed, C. Lower the head of the bed, D. Have a trusted loved one assist with the procedure. The correct answer is raise the head of the bed. Raising the head of the bed, Fowler's position, mimics the natural sitting position for elimination. Question 13. A resident has the following symptoms: expelled brown fluid from the rectum, excessive amounts of flatus, and light abdominal cramping. Which of these is most likely the cause of these symptoms? A. A blood clot, B. A stroke, C. A heart attack, D. An enema. The correct answer is an enema. These are intended and expected effects of an enema administration. Question 14. Which of these is not a signal for notifying the charge nurse regarding a resident's ostomy bag? A. Pus draining out of stoma, B. A sudden increase in the amount of stool in the pouch, C. Skin around the stoma is bulging, D. A temp of 98.8 degrees. The correct answer is a temp of 98.8 degrees. 98.8 degrees Fahrenheit is a normal body temperature. Question 15. The medical term for a device with two soft plastic prongs that attach to a plastic tube delivering oxygen is A. Oxygen diffuser, B. A nasal shunt, C. Nasal antihistamine, D. Nasal cannula. The correct answer is nasal cannula. A nasal cannula is the standard device described. Question 16. A resident with venous stasis has developed pressure sores under elastic stockings. What is the most likely cause? A. The resident is allergic to the elastic. B. The elastic stockings are the wrong treatment and should be removed. C. There are wrinkles in the elastic stockings. D. The resident has been scratching on his or her legs. The correct answer is there are wrinkles in the elastic stockings. Wrinkles in compression stockings create pressure points that can damage fragile skin. Question 17. To avoid pulling the catheter when turning a patient, the catheter tube should be taped to the patient's A and E, B. Outer thigh, C. Bed frame, D. Upper thigh. The correct answer is upper thigh. Securing the catheter to the upper thigh stabilizes it during movement. Question 18. Which is the standard for measuring urinary output? A. Milliliters, B. Cups, C. Ounces, D. Liters. The correct answer is milliliters. Healthcare output is measured in milliliters, ml, or cubic centimeters, cc. Question 19. Which is the best advice if you are uncertain you are able to move an obese patient on your own when it's time for their scheduled repositioning? A. Try to move the client alone. B. Ask the family to assist you. C. Give the patient something sturdy to grab onto and encourage him or her to move. D. Ask another NNAAP to help. The correct answer is ask another, not a help. Safety first, always ask for assistance if the load is potentially too heavy. Question 20. Which of these best describes the purpose of padded side rails? A. To protect a resident from injury. B. To prevent skin breakdown. C. To keep a resident in the proper position. D. To use a restraint. The correct answer is to protect a resident from injury. Padded rails are often used for patients prone to seizures to prevent injury against the handrail. Question 21. A resident is ill with the following symptoms: fever, swelling, redness, and chills. The resident most likely has A. Arthritis. B. Infection. C. An allergy. D. Food poisoning. The correct answer is infection. These are the classic systemic and local signs of infection. Question 22. Which of these would most likely be used to protect a resident from inflicting immediate harm to themselves in a care facility setting? A. Isolation. B. Watch schedule 24/7. C. Additional staff. D. Restraints. The correct answer is restraints. While a last resort, restraints are used to prevent immediate physical harm. Question 23. Which of these applies to proper hand washing procedures? A. Use friction for 15 seconds. B. Use only antibacterial soap when washing hands. C. If the soap doesn't lather, it's important to use longer friction time. D. Use a paper towel to turn off the faucet. The correct answer is use a paper towel to turn off the faucet. Using a paper towel prevents recontaminating clean hands on the dirty faucet handle. Question 24. Why is an axillary reading generally lower than the other forms of taking a temperature? A. It's placed deeper in the body. B. It's taken for a shorter period of time. C. It's not inside the body. D. It's taken at the back of the body. The correct answer is it's not inside the body. Axillary, armpit, temps are external and do not capture core heat as effectively. Question 25. Which of these is the correct step in taking a radial pulse? A. Press lightly on the side of the neck with the pads of 2 fingers. B. Press lightly against the radial bone with your fingers. C. If the pulse is erratic, count an extra 90 seconds. D. Count the number of beats in 30 seconds and then triple it. The correct answer is press lightly against the radial bone with your fingers. The radial pulse is felt at the wrist against the radius bone. Question 26. Which statement is false with regard to taking a rectal temperature? A. The thermometer should be inserted 1 to 1.5 inches in an adult. B. A rectal temperature reading may be slightly higher than an oral temperature reading. C. Mercury thermometers are preferred for accuracy. D. Wipe the resident's rectum when finished, if needed. The correct answer is mercury thermometers are preferred for accuracy. Mercury thermometers are rarely used now due to toxicity risks. Digital is preferred. Question 27. A pulse can be taken in all of these areas except A. Behind the knee. B. The back of the head. C. The inner wrist. D. The side of the neck. The correct answer is the back of the head. There is no major palpable artery on the back of the head. Question 28. Which statement is incorrect regarding the Heimlich maneuver? A. If the resident is coughing violently, proceed with the Heimlich maneuver immediately. B. Place your hands around the resident between the xiphoid and the umbilicus. C. To properly apply the Heimlich maneuver, make a fist with your hands. D. If you are alone and choking, you can perform the Heimlich maneuver on yourself using the back of a chair. The correct answer is if the resident is coughing violently, proceed with the Heimlich maneuver immediately. If the resident can cough violently, the airway is not totally blocked, encourage coughing first. Question 29. ANA may help in alleviating the use of restraints on a resident using all of these suggestions except A. Bringing out a restraint so the resident is reminded they will be used if the behavior continues. B. Redirect or distract a resident. C. Becoming aware of the triggers that make a resident agitated. D. Learning what activities calm a resident down. The correct answer is bringing out a restraint so the resident is reminded they will be used if the behavior continues. Threatening a resident with restraints is a form of psychological abuse. Question 30. Transmission-based precautions are A. Part of the standard-based precautions for all residents. B. Added to standard-based precautions when a resident is known or suspected of having a communicable disease. C. Only used during times when an epidemic is declared. D. Not as stringent as other precautions. The correct answer is added to standard-based precautions when a resident is known or suspected of having a communicable disease. These include contact, droplet, and airborne precautions. Question 31. Which of these describes stage 4 of a decubitus ulcer? A. A superficial ulcer that looks blackened or like a deep crater. B. Open area with redness. C. A redness on the skin. D. Open area with damage reaching to the bone, joints, or tendons. The correct answer is open area with damage reaching to the bone, joints, or tendons. Stage 4 involves deep tissue destruction extending to muscle, bone, or tendon. Question 32. When heat is applied to the skin, the blood vessels A. narrow. B. remain the same. C. dilate. D. constrict. The correct answer is dilate. Heat causes vasodilation, widening, increasing blood flow to the area. Question 33. Which of the following is recorded as the systolic blood pressure? A. Where the last sound is heard. B. When the pulse is no longer felt. C. The point 30 mm Hg above where the pulse was felt. D. Where the first sound is heard. The correct answer is where the first sound is heard. The first tapping sound, Korokov phase 1, is the systolic pressure. Question 34. A fracture-type bedpan is used for residents who A. have had a hip surgery. B. are in traction. C. have a back injury. D. all of the above. The correct answer is all of the above. Fracture pans are flatter and easier to slide under patients who cannot raise their hips high. Question 35. When making a bed, A. raise the bed to the level of your hips. B. do not raise the bed. C. raise the bed to the level of your waist. D. raise the bed 12 inches. The correct answer is raise the bed to the level of your waist. Working at waist height prevents back strain. Question 36. A normal adult blood pressure is A. 180/80. B. 116/70. C. 134/90. D. 80/40. The correct answer is 116/70. 120/80 is the standard reference, 116/70 falls within the healthy range. Question 37. Which medical position can be described as, the patient's head is elevated with legs either bent or straight? A. a Fowler's position. B. a Rose's position. C. Sims' position. D. a Trendelenburg's. The correct answer is Fowler's position. Fowler's position is the standard semi-sitting position. Question 38. Which of these examples demonstrates using proper body mechanics when helping to lift a resident in bed? A. Bending at the waist, knees locked, using arm muscles to lift. B. Bending at the waist, knees unlocked, using arm muscles to lift. C. Bending at the waist, knees partially flexed, using leg muscles to lift. D. Bending at the waist, knees unlocked, using back muscles to lift. The correct answer is bending at the waist, knees partially flexed, using leg muscles to lift. Lifting with the strong leg muscles, quadriceps, protects the back. Question 39. The best use of alcohol-based sanitizer is A. When helping with catheterization. B. When hands are not visibly soiled. C. When hands have blood from a cut. D. When hands are visibly soiled. The correct answer is when hands are not visibly soiled. Sanitizers are effective when hands are not visibly dirty, otherwise, soap and water is required. Question 40. Which of these is incorrect in reference to wearing gloves? A. Always wear latex gloves because they are the most impermeable option. B. Wash hands before putting on and after removing gloves. C. Upon removal, avoid letting the outer layer of the gloves contact your skin. D. Peel the glove away from you so it comes off inside out. The correct answer is always wear latex gloves because they are the most impermeable option. Many people have latex allergies, so non-latex options, nitrile/vinyl, are frequently used. Question 41. If you are walking with a resident and they fall, which of these is not an action you should take? A. Supply information for the nurse so proper documentation can be made. B. Inform the nurse. C. Help the resident off the floor and into the nearest chair. D. Keep the resident from moving until you can assess if they have injuries. The correct answer is help the resident off the floor and into the nearest chair. Never move a fallen resident immediately, they must be assessed for injury first. Question 42. The medical term tetraplegia, meaning paralysis of all four extremities, is often used interchangeably with the term A. Quadriplegia. B. Hemiplegia. C. Paraplegia. D. Cardioplegia. The correct answer is quadriplegia. Quadriplegia and tetraplegia both mean paralysis of the torso and all four limbs. Question 43. Which of these is not true when taking a blood pressure reading? A. The optimum position for the resident is sitting with both feet on the floor. B. It's best if the resident doesn't talk while his or her blood pressure reading is being taken. C. Blood pressure readings can be a little higher in the mornings. D. The optimum position for the resident is lying down with his or her feet elevated. The correct answer is the optimum position for the resident is lying down with his or her feet elevated. Elevating feet typically increases venous return and is not the standard position for routine BP checks. Question 44. A resident has the following symptoms: dizziness, feeling faint, blood pressure below 90/60ths, and cold, sweaty skin. The resident is most likely suffering from A. Hypertension. B. Hyperemia. C. Hypoioditis. D. Hypotension. The correct answer is hypotension. Hypotension, low blood pressure, causes dizziness and shock-like symptoms. Question 45. The normal pulse rate for an adult is 60 to 100 bpm. The normal pulse rate for children is A. 70 to 120 bpm. B. 60 to 100 bpm. C. 55 to 105 bpm. D. 40 to 60 bpm. The correct answer is 70 to 120 bpm. Children have faster metabolic rates and heart rates than adults. Question 46. Alcohol-based hand cleanser is appropriate for all of these situations except A. When soap and water are not available. B. After walking a resident down the hall. C. When hands have observable dirt. D. After handling a resident's clothes. The correct answer is when hands have observable dirt. Observable dirt must be washed away with soap and water. Question 47. Which of these is not true about the proper procedure for taking a tympanic membrane temperature with an electric thermometer? A. Use a speculum cover that is twisted securely in place. B. Be sure the ear is free of cerumen, earwax, before inserting the unit. C. Wait for the unit to signal before removing the speculum. D. Be sure that the speculum fits snugly by pulling on the ear pinna. The correct answer is be sure the ear is free of cerumen, earwax, before inserting the unit. While impaction affects readings, NAS generally do not clean earwax as a prerequisite step for this task. Question 48. If you're helping a resident put on a clean nightshirt and it falls to the ground before you get started, it is best to A. Ask the resident if they want to go ahead and use the dropped shirt. B. Place shirt on the chair and go to get a clean garment. C. Tell the resident to wear the shirt until you can go and get a clean one. D. Put the shirt in the hamper for cleaning and get another clean garment. The correct answer is put the shirt in the hamper for cleaning and get another clean garment. Items on the floor are considered contaminated. Question 49. Convulsions are associated with A. A spasm. B. A tear. C. A seizure. D. A sprain. The correct answer is a seizure. Convulsions are the involuntary muscle contractions often seen during seizures. Question 50. When muscle tissues shorten and then a joint becomes hard to move, it's called A. A perforation. B. A contracture. C. A twitch. D. A rupture. The correct answer is a contracture. Contractures are the permanent tightening of fascia, muscles, tendons, ligaments. Question 51. Which of these tasks related to intravenous therapy is in the scope of responsibilities for an A? A. Get the intravenous feed into the patient and then call the supervising nurse to assess. B. NAs are not allowed to be involved in the intravenous process. C. Prepare the proper solution. D. Watch the drip and report any problems. The correct answer is watch the drip and report any problems. NAS observe and report, they do not manipulate IVs. Question 52. If you smell smoke and discover a resident smoking in his room, it's best to A. Have him stop and remind him of the facility policies because of the hazards it creates to every resident. B. Tell the residents you will allow him to finish his cigarette, but you are obligated to report it if it happens again. C. Call the family contact and ask them to deal with their loved one on this issue. D. Ignore the first incident but report it if it happens again. The correct answer is have him stop and remind him of the facility policies because of the hazards it creates to every resident. Immediate safety is the priority. Fire hazards must be stopped instantly. Question 53. A resident is supposed to have 240 ml of juice every 2 hours. Which of these choices would be the most convenient to meet this requirement? A. A 12 ounces can of juice. B. 8 ounces can of juice. C. 5 ounces can of juice. D. 4 ounces can of juice. The correct answer is 8 ounces can of juice. 240 ml is approximately 8 ounces. Question 54. All of these might be used in dealing with contractures except A. Hand roll. B. A repositioning. C. A bandaging. D. A physical therapy. The correct answer is bandaging. Bandaging does not prevent contractures, hand rolls and ROM exercises do. Question 55. Hypertension is a medical term for A. High blood pressure. B. High anxiety. C. Hyperactivity. D. Tense muscles. The correct answer is high blood pressure. Hypertension is chronically elevated blood pressure. Question 56. To minimize the spread of bacteria, further infection and contamination, which procedures should be used for washing the perineum of a resident with a catheter? A. Wash from the meatus out. B. Wash from the rectum to the scrotum. C. Wash with peroxide. D. Wash from the rectum to the meatus. The correct answer is wash from the meatus out. Always clean from the insertion site, meatus, outward to push bacteria away. Question 57. Which of these should not be part of the process for cleaning a resident's dentures? A. Rinsing thoroughly. B. Placing clean dentures on top of a tissue on the resident's table. C. Patting the sink. D. Washing your sink. The correct answer is placing clean dentures on top of a tissue on the resident's table. Dentures should be stored in a cup with water, not left to dry out or get contaminated on a table. Question 58. A resident in your care has called for help. He claims he can't find his dentures. As a NNAAP, it's your responsibility to A. Notify the supervising nurse. B. Document the loss in the patient's medical record. C. Tell the resident that you will notify the family contact member. D. Ask the resident to refrain from eating until the dentures are located. The correct answer is notify the supervising nurse. Reporting the loss protects the resident and staff. The nurse will handle further documentation/family contact. Question 59. Applying friction in the hand-washing process is very important. According to CDC recommendations, the scrubbing portion of hand washing should take A. 60 seconds, B. 10 seconds, C. 20 seconds, D. Any amount of time, as long as you scrub until hands feel clean. The correct answer is 20 seconds. 20 seconds, singing Happy Birthday twice, is the standard recommendation. Question 60. All of these precautions should be followed when using a transfer gate belt, except A. Never using a frayed or worn transfer gate belt. B. Placing transfer belts around the resident's waist. C. Not worrying about proper body mechanics. D. Slightly rocking and pulling when using a gate belt on a resident in a sitting position. The correct answer is not worrying about proper body mechanics. Body mechanics are always essential to prevent injury. Question 61. Which of these is considered an accurate method for counting respiration rate? A. The resident counts to 30 while the NNAAP counts respirations. B. The NNAAP watches abdomen while the nurse looks at her watch to time 30 seconds. C. The resident counts to 30 while the NNAAP counts respirations. D. The NNAAP looks at the resident's abdomen and a watch at the same time. The correct answer is the NNAAP looks at the resident's abdomen and a watch at the same time. The NNAAP must observe the chest/abdomen and the watch simultaneously. Question 62. To obtain the most accurate patient weight, the NNAAP should weigh the patient A. directly after a meal. B. With two different scales. C. 3 to 4 hours after eating. D. At the same time every day. The correct answer is at the same time every day. Consistent timing, usually morning, eliminates variables like food/fluid intake. Question 63. A NNAAP is instructed to take the oral temperature of a patient who just had a cold drink. The patient's temperature should be taken A. 3 to 5 minutes after the drink was finished. B. 15 minutes after the drink was finished. C. Immediately. A cold drink should not affect the reading of most oral thermometers. D. 20 to 30 minutes after the drink was finished. The correct answer is 15 minutes after the drink was finished. Waiting 15 to 20 minutes allows the mouth to return to baseline temperature. Question 64. A NNAAP is caring for a patient with MRSA and is wearing a gown and gloves whenever she provides the patient care. When she needs to go care for another patient, she should dispose of her gown and gloves A. in a dirty utility room. B. in the hallway. C. in the current patient's room. D. in the next patient's room before touching that patient. The correct answer is in the current patient's room. PPE must be removed inside the isolation room to prevent spreading pathogens to the hall. Question 65. Another term for decubitus ulcer is A. a pressure sore. B. perforation. C. ulcerated cyst. D. ulcerated tumor. The correct answer is pressure sore. Decubitus ulcers are commonly known as pressure sores or bed sores. Question 66. Why is taking a resident's oral temperature the most common means of obtaining a reading? A. It's the only method residents will accept. B. It's the most cost-effective means of taking a temperature. C. It offers the most ease of access and least inconvenience to the resident. D. It's more accurate than other methods. The correct answer is it offers the most ease of access and least inconvenience to the resident. Oral temps are non-invasive and convenient for cooperative adults. Question 67. When transferring a resident from a wheelchair to stationary chair, the NNAAP should stand A. In front of the wheelchair. B. To the right side of the wheelchair. C. Behind the wheelchair. D. To the left of the side of the wheelchair. The correct answer is in front of the wheelchair. Standing in front allows the NNAAP to control the transfer and support the patient. Question 68. Which of these could be considered neglectful when assisting a resident with showering? A. Respecting the fact that bathing and showering can be scary activity for residents. B. Being patient and calm and explaining what you are going to do. C. Leaving the resident alone, so they are motivated to care for themselves. D. Being sensitive to water temperature and testing it. The correct answer is leaving the resident alone, so they are motivated to care for themselves. Leaving a resident alone in the shower poses a severe fall and safety risk. Question 69. A resident in your care is suffering chest pains. Which of these is not a direction to follow? A. Offer support and reassurance. B. Talk and act in a calm manner. C. Have the resident take small sips of water and place them in a downright position. D. Call for help immediately. The correct answer is have the resident take small sips of water and place them in a downright position. Do not give food/water to a potentially unstable cardiac patient, aspiration risk/possible surgery. Question 70. All of these are ways to prevent pressure sores except A. Changing soiled sheets quickly. B. Changing positions regularly. C. Providing extra blankets. D. Avoiding wrinkles in sheets. The correct answer is providing extra blankets. Extra blankets can cause overheating and moisture, which may contribute to skin breakdown.